We're hearing stories of people being turned away 2, 3, 4 times, presenting in hospitals, presenting in emergency rooms, literally being nearly out of breath, but not being admitted. And I mean, it's just, again, this is why these deaths are just so devastating and so tragic. But I think there's also some very explicit bias happening. So for example, when we look at a protocol for rationing of care, many of the algorithms that are used to ration care utilize pre-existing comorbidities as a part of the algorithm to say who gets life-saving equipment such as ventilators, right? We know that Blacks, Latinos, poor folks are disproportionately among those who have comorbidities. So programmed into the algorithm that says who lives and who dies or who gets life-saving equipment is like racism, because those comorbidities are caused by, again, these structural factors that have existed in our country for decades and decades and decades, right? And so there's so many, and that's why we have to see this as a very vicious system of structural racism that's operating, because it's not just one thing, it's not two, it's all of these things together that are really, again, creating the system of increased exposure, increased transmission, and increased death, particularly among the most marginalized populations in this country. And so, I mean, there's so many things and so many ways that this is just showing up during this pandemic. And as Dr. Carey said, this is just really exposing what already existed before this crisis.